Living with CF, how to handle chronic lung infections. Living with cystic fibrosis can be challenging, especially when it comes to managing chronic lung infections. Cystic fibrosis causes thick, sticky mucus to build up in the lungs, creating a breeding ground for bacteria. This makes it essential to handle these infections effectively to maintain lung function and overall quality of life. One of the first steps in managing chronic lung infections is regular monitoring and early detection. Patients should have respiratory samples collected frequently, such as sputum or cough swabs. This helps identify bacterial infections early, allowing for timely treatment that can prevent further lung damage. Targeted antibiotic therapy is a cornerstone of managing lung infections in cystic fibrosis. Depending on the severity and type of infection, treatment may include inhaled, oral, or intravenous antibiotics. Inhaled antibiotics are particularly effective for chronic infections caused by bacteria like Pseudomonas aeruginosa, which is common in the lungs of people with cystic fibrosis. These antibiotics help control the infection directly in the lungs. For more severe cases or acute pulmonary exacerbations, oral or intravenous antibiotics may be necessary. Additionally, long-term use of antibiotics like azithromycin can help reduce inflammation and bacterial load, even if a patient is not currently infected with Pseudomonas aeruginosa. Airway clearance techniques are also vital for managing mucus in the lungs. Physiotherapy techniques and devices can help loosen and remove thick mucus, reducing bacterial growth and improving breathing. Mucus-thinning agents, such as hypertonic saline inhalation, can aid in this process. Bronchodilators may also be used to relax airway muscles and keep the airways open, making it easier to breathe. Anti-inflammatory treatments can play a role in reducing airway inflammation caused by chronic infections. These medications help preserve lung tissue and maintain lung function. Nutrition is another important aspect of managing cystic fibrosis. Good nutrition supports immune function and overall health, which is crucial for fighting infections. Patients may need pancreatic enzyme supplements and other supportive treatments to maintain their nutritional status. Preventive measures are key in reducing the risk of respiratory infections. Annual vaccinations for influenza and pneumococcal diseases are recommended. Additionally, avoiding exposure to respiratory pathogens and practicing good hygiene can help keep infections at bay. Receiving specialized care from a multidisciplinary team is essential for effective management. Cystic fibrosis care centers provide comprehensive support, including pulmonologists, infectious disease experts, physiotherapists, nutritionists, and social workers. For complex cases, consultations with microbiologists or infectious disease specialists may be necessary to tailor therapy effectively. Ongoing research is also promising. New treatments, such as cystic fibrosis transmembrane conductance regulator modulators, are improving outcomes for many patients. Research into the lung microbiome is expanding our understanding of how microbial communities affect lung health and may guide future therapies. In summary, handling chronic lung infections in cystic fibrosis requires vigilant monitoring, timely antibiotic use, airway clearance techniques, inflammation control, and supportive care within a specialized framework. This comprehensive approach can help slow lung function decline, reduce infection frequency, and improve quality of life. Always consult healthcare professionals for personalized medical advice and treatment plans tailored to individual needs.